Hello, welcome class. My name is Holadia. I've been a registered nurse for 22 years. I've worked the past 20 years in the ER and then left there and went November last year to the admission unit where we process admissions coming from the ER and transfers from outside hospitals. Over the past 3 weeks, we've been debating with my classmates on Senate Bill number 544, which was filed Tuesday, April 2nd, 2019. This bill was introduced to create an act to direct healthcare providers to initiate acute or chronic pain management care with non-opioid treatment alternatives whenever possible. It also was to create a uniform voluntary non-opioid directive form and to establish a process for patients to voluntarily elect non-opioid pain management care and the establishment of insurance coverage for these non-opioid management care. During our debate, I strongly feel that the best argument to support this bill is that opioids for acute and chronic pain management has been considered the standard care for many years, but unfortunately, this has led to an opioid addiction crisis in America. In 2016, 2.4 million Americans were estimated to have an opioid use disorder ranging from misuse of prescription opioids to the abuse of heroin or other illicit drugs. The scariest part of all this is 0.6% of adolescents from the age of 12 to 17 years of age and 1.1% of young adults 18 to 25 years of age are addicted to opioids. This bill will hopefully decrease these numbers and decrease the use of opioids by using alternative treatments and mandate insurance pay for these alternative treatments. During the debate, my biggest concern as a nurse is what if this bill passes and keeps patients that, like your end-stage cancer patients that are suffering from terminal illness and extreme pain from being able to have their pain managed effectively? Will this bill require palliative care providers to start with non-opioid medications and treatments and escalate once they're found not to be effective for our patients? What about a trauma patient that's had multiple fractures or needs extensive surgeries and treatments and post-traumatic therapies and have post-trauma pain? Will they be managed appropriately? Maybe insurance could stop paying for opioid treatments altogether if they're paying for these other treatments. Do we need this act? Yes, absolutely. Even if it's only a few that are addicted, we still need better management using non-opioid treatment. This bill was filed by the Senate on April 2nd, 2019, was passed April 3rd on the first reading. It's been passed on to the Senate Committee on Rules and Operations for their review. There have been no votes taken, but there have been 2 Democratic and 2 Republican senators that support this bill. After reviewing all the debates for and against the bill, I support the bill and hope the legislature moves quickly ahead with this bill. The 3 reasons that I strongly support this bill are from the nursing standpoint. It will help decrease opioid addiction problems by hopefully using less opioids and offering patients other alternative therapies for pain management. From a cost and insurance standpoint, this will help patients get alternative treatments covered, and hopefully this will lead to better compliance with these treatments and better outcomes. This act will also require training and programs to be established for providers and healthcare professionals that include evidence-based content, competency testing, so that these providers have the skill set needed not only to prevent and treat chronic pain, but also to help those that have substance abuse disorders as well. This current bill was written and has a tentative start date of January 1st, 2020, but still in the committee review stage. This bill could benefit many patients and providers and needs to be fast-tracked in order to meet the needed and planned implementation date of January 1st, 2020.